Hello, my name is Dr. Katinka Vandermeer and I am author of Putting Out the Fire, New Hope for RSD CRPS. We are a few days away from the release of my book and I just wanted to take a couple of minutes and visit with you guys about the book and what my hopes and dreams were for this book before I started writing it. I've worked with CRPS RSD for 5 years and I am extremely passionate about it. There is, in my opinion, no worse condition out there that can afflict people and take not only your lives away, but that of your children and your parents and your co-workers and your husbands and wives. So it leaves very deep marks in people's lives. It is very rewarding to help people who suffer from this condition. The other thing is that there is so much misinformation, even amongst medical doctors, and especially in the allopathic world, where some people still say that CRPS cannot spread and it cannot affect your entire body, and it doesn't affect your senses like your vision and your hearing or your digestive tract, where you go to doctors and they try to treat all these symptoms as separate symptoms, where the body should be treated as a whole. The book talks about the central nervous system and its role extensively. What most people do not realize is that healthy bodies do not develop CRPS. Something was wrong with your central nervous system before you ever suffered what we call the trigger injury that most people blame for their CRPS. Your autonomic or automatic nervous system is divided into two parts: parasympathetic or rest and digest, and sympathetic, which is fight or flight. Most people who develop CRPS for genetic or other reasons have a state where they stuck in sympathetic or fight and flight overdrive before the trigger injury ever happened. Our treatment, the 4-punch system, focuses on 4 different treatments that naturally and holistically balance the whole body and bring normality back to the central nervous system so that your body can function better again. We should know within the first week or 2 weeks whether you will respond to treatment before we start the 10-week treatment program. So we talk about our 4-punch system extensively in the book, but we also discuss the impact that it has on your family members, the high suicide rate that is found among CRPS patients, and that is not talked about very often. We talk about the symptoms that lots of people do not even know are connected. For instance, hearing loud sounds or how vibrations or loud music will really increase your pain and why that is. Why bad weather will really make your pain worse. The genetic impact and how you may have been set up genetically to suffer from CRPS. We talk about the emotional impact on your family members, your loved ones, your children, what it's like to be a parent and watch your child suffer from this condition. I really wanted this book to be the definitive guide to this condition so that you can go to a family member or friend or co-worker or your medical doctor and hand them this book and say, here, please read this. I hope you guys enjoy the book. I hope that it helps you in even the smallest way, because that is my passion and my reason for getting out of bed besides my family is to help patients just like you. We're very excited to release this book November 1st, Tuesday, and you can get it on Amazon. Thank you for watching this.